Hi, I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today I'm answering the question, are antidepressants addictive? That answer is no. Thanks for watching. Just kidding. Antidepressants are not addictive in the way that we think of or define addiction. Some people feel like if you take a medication and it helps with something, then when you try and stop it and the problem comes back, it came back because you're now addicted to the medication. But that's just not really addiction and how it works. Addiction is when you develop a physiological tolerance to the medication and a psychological dependence. So let me break this down. Physiological tolerance is when you take a medication and it works for a while, but then over time you need to get more of it for the same effect. And there are certain medications in psychiatry that have this tolerance effect. The main ones are the benzodiazepines like Klonopin and Xanax, and stimulant medications like Adderall or Ritalin. Tolerance develops to these medications because of the way that they work in your brain. It has to do with the receptors that are affected and the behavior of those receptors. So you can start out taking a small dose of Xanax to treat your anxiety, and that works for a while until eventually you notice that that dose doesn't seem to work as well. So you need to go back to your doctor to increase the dose so that your anxiety goes away like it did before. And this is a normal reaction that happens to most people. If it happens to you, it doesn't mean that you have an addiction. This is a natural process that occurs with some of these medications. Tolerance only happens to a minor degree with antidepressants, and I talk about that in this video. But even if it does happen, it doesn't mean you have an addiction. The second part of addiction is the psychological dependence. And this occurs when there's a psychological reward that you experience from taking the medication, and you start to crave that reward. So let's go back to the Xanax example. You can take Xanax for panic attacks that you start to experience every time you watch the news or go to the grocery store. So before you make your trip to the store, you take a Xanax to calm down so that you can shop without having a panic attack. You start out only using it for this purpose, but then when you start having fights with your spouse, you start using the Xanax to help you settle down from the arguments. Before you know it, anytime you experience a negative situation, it feels too overwhelming to handle, so you take a Xanax to get through it. That's an example of developing a psychological dependence. When you're at this point, you lose your ability to tolerate the distressing situations and feel you need a medication to take away those unpleasant emotions. Now you may say, isn't that what happens with antidepressants? You take the pill to make depression go away. Well, yes, you do, but the difference is that you're treating a medical condition and not a temporary emotion. Depression is more than negative emotions. It's a daily experience that affects your mood, your sleep, your appetite, your outlook on life, and it can even affect your thinking abilities, making it hard for you to concentrate or problem solve or even get out of bed. So that's why you take antidepressants daily and not only on an as-needed basis to make yourself feel happy for the day. Addiction is more reactive to transient situations. One time I had someone with whom I was only doing therapy and they weren't taking medication, and I got a request from the person saying, Dr. Marks, I'm getting ready to break up with my partner, so I need you to prescribe me something so that I can get through it. That's an example of a psychological dependence on something like a pill or a drug to escape experiencing negative emotions. People don't develop that kind of craving or dependence on antidepressants. The antidepressants don't give you instant results like you can see with the benzodiazepines and stimulants. Another misconception that people have about starting an antidepressant is that if they take it and they feel better, they're going to always need to take it to feel better. I usually respond to this by saying, what about someone who takes blood pressure medicine? If you have high blood pressure, you take the medication and your blood pressure goes down. If you stop taking the medication, your blood pressure goes back up. Does that mean that the medication made you need to always have it and be on it forever? The blood pressure medicine treats a condition, and when you don't take it, that condition comes back because you have high blood pressure. Whether or not you will always have high blood pressure depends on your body and not whether or not you start taking medication for it. And it's the same with depression. In fact, depression is a little better than high blood pressure when it comes to this issue of how long you need to take the medication. Depression tends to come and go in episodes that last 6 to 9 months on average, and for some people it can last longer than that. If you take medication and your depression goes away, we recommend that you stay on the medication long enough to get through the natural cycle of the illness. And I normally recommend 1 year. If you stop taking the medication after a few months, your depression can come back, but the reason is because the state of your depressed brain has not recovered yet. It's not because the medicine made you still need it. In this case, a return of your symptoms would be considered a relapse of your illness. Now, not to get too complicated here, but if you suddenly stop your medication, you can get medication withdrawal symptoms like extreme sadness, stomach upset, diarrhea, flu-like symptoms, and other things. And this happens because your body is used to a certain exposure of the medication, and when the medication levels suddenly drop, it's like your nerve cells say, "Where did it go?" And this can happen with any medication that you take, and it's not the same as an addiction. If you take Tylenol every day for headaches, if you stop it suddenly, you can have rebound headaches until your body finds a new equilibrium. Let's say you notice that when you take your antidepressant, you feel a sense of elevation in your mood. Wouldn't that pull you into a psychological dependence? No, because the effect usually is temporary and not strong enough to make you crave the medication as needed. Antidepressants just don't trigger the reward pathway in your brain that reinforces addictive behavior. If you find that you can't seem to get off your medication because your depression keeps coming back, it's not because the medication made you that way. It's because you have more of a chronic form of depression that lasts for longer periods than the usual year. And there are many people like that. They end up taking medication for years at a time. Last point here. What if you are someone who takes a medication and it works for a little while and then it stops working and you can't seem to get on something that lasts long enough? Does this mean you have a tolerance problem? Probably not. It's possible that you're in the minority of people who develop a tolerance to some antidepressants. But other possibilities are that you had a placebo response to the medication. A placebo response occurs when you have what looks like a therapeutic response when you shouldn't. The term is usually used in research studies when someone is in a group that takes a sugar pill and doesn't know it, and they still report improvement in their symptoms. And this is a powerful psychological reaction that you can think of as mind over matter. If you believe the thing that you put in your mouth will help you, it does. This can also happen when you start an antidepressant as well. I've had people say that they felt better right after they took the first pill, but it takes 5 half-lives to reach a steady state level in your bloodstream. And you need that steady state level of the medication to really have a therapeutic effect. Most of the antidepressants have around a 24-hour half-life, some more. So that means at a minimum, you need at least 5 days for the pill that you took to reach steady state level in your bloodstream and in your brain. So an improvement after the first pill is more than likely a placebo response, meaning it's not really due to the therapeutic effect of the medication. So this could explain how you can take a medication, have it work really well for a few days, then seem to just stop working. Another reason this can happen may be that you're treating something that you don't really have. People can be prescribed antidepressants for feeling sad or being in a bad situation when they really don't have a clinical depression. I talk about this phenomenon in this video on telling the difference between feeling depressed and having depression. If you're skeptical about starting a medication for depression or anxiety because we use antidepressants to treat both conditions, please understand that having a positive effect from the medication that goes away when you stop taking it doesn't mean that the medicine is pulling you into a dependence. It's treating a condition that can come and go over the course of your life. Being on medication doesn't make you always need it. If your condition has resolved and passed on, you can taper off the medication without your symptoms returning immediately. Of course, this is something that you would want to do with your doctor, though. Take a look at these other videos that I have on talking about depression. See you next time.